I would like to welcome you all to this 8th annual conference of the Indian Society of Medical and Pediatric Oncology, and my greetings to you for a happy, successful, and a very safe 2022. Going back in time, the ISMPO, with its inception, was a very fledgling society with a very small membership, but has grown numerically in strength, also in its activities, educational activities, as well as collaborations. And several developments have taken place over the last few years to give credence to this. So, just going over the activities of the ISMPO, it's like reinventing relevance. So, it's gained in numerical strength. We have a new website which is very proactive. The IGMPO is our flagship journal, and it has been very well streamlined under the very able leadership of our editor, Dr. Padmaj Kulkarni, and his team, and he'll be expanding on that. We have several educational activities, international collaborations. We are building on a patient portal, and of course, you've had a glimpse of Women for Oncology in the past session, and we have several future plans for our members. If you look at the ISMPO website, which is a new website which has been created thanks to Riverroot, you can see that it's updated and scalable. There are meeting archives. You have an ISMPO insight section by experts who actually, especially for the postgraduates, give their insights on recent advances during the course of the year on different subjects. It has the ability to host conferences, and of course, it is search engine optimization friendly. If you look at the Indian Journal of Medical and Pediatric Oncology, I would not like to steal the thunder from Dr. Padmaj Kulkarni. So, very briefly speaking, this is our website and the journal cover. And then, of course, several developments have taken place. There's been a change in the publisher. There is a zero pendency and cleared all pending manuscripts up to December 2021. There are increased submissions, which is very heartening, from 2,000 per year to almost 600 in the last year, despite the pandemic. And then there is an increased efficiency with publication time from the time of submission being about 6 months, and all accepted articles are published ahead of print. So this is a great job which has been done by Dr. Padmaj Kulkarni, and all kudos to him and his team. This is just again to show you a brief view of the insights. Now, what about the educational activities? There has been the ISMPO initiated program, which the executive committee decided on, and we would be having these workshops almost every 2 months on varied subjects, especially subjects which are very important for the young oncologists and which have not been covered in so many of the webinars, which has been an offshoot of this pandemic. Then, of course, we have had, partnered with the industry and had a workshop relating to precision oncology, lung cancer, and women's cancer. There has been also been an 4 days onco summit on breast cancer, lung, and genitourinary cancers. There has been a masterclass in breast cancer with a lot of international participation. You can see this is one of the workshops on oncology, precision oncology. Then, of course, the ISMPO Con 2022, which is, just begun. And I'd like to, focus on some of the highlights of this meeting. As you know that there are 2 themes over 2 weekends, and we have been trying to cover all the rare tumors and rare situations in common cancers in the first half. These are all sticky wickets in oncology that we have to deal with. And then in the second half, we are going to talk about sequencing and how it has translated into treatment paradigms. We have a large international faculty of 29 members, and then a very large Indian faculty which spans the whole country. So they are 370 in number. We have submission abstracts of 176, multidisciplinary tumor boards, which are 10 in number, joint symposia with ESMO as well as ASCO. And the highlight of this is the participation of both the presidents of, the presidents of both the societies. We also have quiz and oral and poster presentations, and we are having a large participation on this front as well. Then coming to the other activities like the publications from the ISMPO. So this was spearheaded by Dr. Hemant Malhotra, and it was an expert consensus document related to the management of hereditary breast and ovarian cancer, which got published in the Journal of Oncology Practice. Then, of course, coming to the international collaboration, ISMPO is a premier society of medical oncologists and has attained international recognition, and the was invited by ESMO to be a partner in the adaptation of the ESMO guidelines to the Asian context. And in this, we were in partnership with several other Asian societies, and it covered, we were part of the what are known as the PAGA guidelines for renal cell, head and neck, breast cancer, colon, and lung cancer. And these have all got published in the Annals of Oncology. Now, what are the future plans? Dr. Kumar Prabhash is going to expand on that, but we are looking at widening the reach and the members' engagement through zonal committees and Young Oncologist Forum. We would like to have an exclusive portal for the patient information and be very active on the social media, serving as an incentive for members as a publicity platform. Now, what are the two mottos? We are moving from wanting to things to happen to wishing that things would happen to making them happen. We don't want to lower the expectations to meet our performance, but increase our performance to meet your expectations. And for this purpose, we are going to be having a survey to have the perception of medical oncologists and what they would want and expect from the ISMPO. And I appeal to all of you, whether you are members of ISMPO or not, to take part in this survey so that we can improve our performance. And last but not least, progress is not inevitable. It's up to us to create it. And what are the most important pillars of this? That coming together is the beginning, keeping together is progress, and working together is success. And that is what I appeal to you all for the success of ISMPO in moving forward. And a picture is worth 1,000 words. And with this, I would like to thank you for the patient hearing and also welcome you to this conference. Thank you.